Menopause means changes for women and some that are painful and uncomfortable to talk about. Here with some answers is Dr. Hansen with the Hansen Clinic of Natural Medicine. So great to see you.
Good to see you.
So what conditions are we talking about today and how common are they?
Well, menopause is so common. 32 million women are in menopause every year, and 1 out of 3 have severely painful intercourse. Vaginal dryness is so painful they can't even approach the subject with their husband.
And so what causes this condition?
It's atrophy of the vaginal lining. So as we age, the bones thin, the skin thins, and the vaginal tissue all becomes thin, atrophies, becomes dried out. That increases the risk of vaginal infections, urinary tract infections, and just causes severe pain.
And so are there medications for this?
There's a relatively new medication that is advertised as a non-estrogen, but it's virtually a copy of natural estrogen, but they can't actually patent the real thing. So they make a copy, they twist it a little bit, causes a lot of side effects. So it's called Osphena, and yeah, it causes uterine cancer risk, increased risk of strokes, blood clots, vaginal bleeding, even heart attacks, severe liver problems, and breast cancer. So it has a lot of the same side effects that you'd expect from a lot of the birth control pills. That's not a good thing.
So is there a more natural alternative that's better?
There's a great natural alternative. The body's amazing. So the body makes 3 estrogens. One of them is called Estriol, which is the safe natural estrogen. Is 1,000 times less potent than estradiol, the one that causes all the risks. Few side effects occasionally. I've never seen anybody with nausea and headaches. A little breast tenderness because it binds to the receptors that actually turn down breast cancer risk. That causes some tenderness for a few days. But the typical side benefits are it reduces the risk of breast cancer and uterine cancer, stops the hot flashes, and reverses that vaginal atrophy, reduces urinary tract incontinence and urinary tract infections.
Wow.
So it has all the wonderful benefits, but it's safe, and women just don't know they even have an option because conventional pharmaceutical companies can't patent it, so they don't make it, so they don't advertise it.
Let's talk a little bit about some of your patients and the success that you've had there.
Yeah, that's what I love to talk about. The patient success is what makes me happy to be a doctor. So Becky is one of my patients that came in with this condition about when she was 59. She'd been in menopause for almost 10 years, over a decade. Severe painful intercourse, so severe she couldn't even think about having sex. And zero sex drive, of course you'd think if it's that painful you're going to have no sex drive, but also low testosterone leads to low sex drive and further increases the lack of lubrication. So she had frequent urinary tract infections and then some thyroid issues, hair loss, constipation, and fatigue.
So how do you test for all of this?
We do blood testing, so we're going to look at the hormones, we're going to look at the whole picture. You got to see the whole picture in order to really treat this effectively. It's not just a mere nuisance, it really is a risk of other diseases. So when we test, we see that estrogens are all low here and her testosterone was really low. We got to treat all of those to get her feeling great. And within a few weeks, she had no more pain. She'd had it for over a decade. All the symptoms were gone now, and she felt great. Her sex drive was up. She had improved relationships with her husband and reduced risk of heart disease, cancer, strokes, and osteoporosis.
Happy all the way around, and important, I'm sure, for women to talk about.
Yeah, they need to talk
and
more
you have
about
a special offer right now, Dr. Hansen,
Yeah,
for our
we'd
viewers.
like everyone to go to our website and learn more, see these stories. First 25 callers are going to get $100 off the new patient evaluation. So you can come in and learn about your symptoms and how we can help you and get started and get treated, find out what your hormone levels are, and get you feeling great again.
Dr. Hansen, thank you so much for the great information.
Thank you.
And if you'd like more information about the Hansen Clinic of Natural Medicine, go to drhansen.com or call the number you see on your screen.